And so, again, in our world of financial planning, this is an area that we look at because obviously most people think of us as manage a lot of money in the market and we have portfolios and we mitigate risk there and all that. But this is an area of risk that you have to at least look at and have a plan for. So I guess, what are some ways that folks listening how do they plan for this? Like, what are some of the planning approaches to long-term care?
So before we get into that, I'm going to share with you guys some stats. So in the Massachusetts area, we are one of the more expensive areas to receive care. I mean, just like the housing market.
I guess that's probably not a shock.
Just wanted to share with you. So here's some stats for you. So in Massachusetts, this is 2021, if you were to bring in-home health aides, it cost about almost $62,000 for 44 hours a week.
Jeez.
That's bringing them in. That's basically a full-time job for them, but it's not 24/7. So there's still going to be some involvement from family. Now, if you go adult daycare route, it's about $20,000. So it's less expensive, but it's 5 days a week, and it's you drop off, pick up. Assisted living for a private 1-bedroom, about $54,000. So now we're getting a little more costly because the care is a lot more in those areas. And then when you start talking about nursing homes, this is $95,000 for a semi-private room and around $110,000 for a private room. Wow. Those are the national figures. Now in Massachusetts, that same private room.
I would say that sounded pretty cheap.
The same private room, $173,000.
Jeez.
Now, these numbers are from Genworth. They did a study. Genworth's a large insurance carrier that kind of focuses on long-term care insurance. So on their website, they allow you to do some projections. So that same $172,000 20 years from now, projected to be $321,000.
And those numbers have inflated more than general inflation.
Yeah.
Healthcare and education have inflated more than inflation as a whole, right? So it's like, so basically you have that. We have the figures. We know it's a risk, but what are, I guess, a client probably has 4 or 5 options, right?
Yep.
And can we go through? Maybe let's go through.
Definitely. Yeah. So the first option, if you like I said, this kind of start off is if you don't have a plan, you're going to self-fund it. So that's a strategy. If you have enough resources and you understand kind of where this is going, you can plan for that though. But if you don't have a plan, that's your only option. So number one, you can self-pay it.
Yep.
Number two, you can use traditional long-term care insurance.
That's what people, when they hear long-term care, they assume
the automatic insurance.
Think of, that's long-term care insurance.
Yep.
And I know it's not something that's been done a ton here because of there's a lot of reasons that go into it, but what are some drawbacks to that? Yeah,
so some drawbacks is it's use it or lose it mostly. I mean,
you pay for it, and if you don't use it, there's nothing left.
Yeah. Yep. Plus the premiums you pay, we've seen some substantial increases. I mean, I have some clients that have seen 60% premium increases. Yes. And so that's a variable for your income plan, right? So all these areas interact. And so if you have this variable that premiums are rising, it could impact other areas. I mean, you don't want to forego the long-term care insurance if you've been paying it for so many years, but you have to kind of work that in. And the more things you can control, the better off you'll be long-term.